You're at work or out having a fun day with your family, and out of nowhere comes crushing chest pain. And your mind immediately goes to, oh no, I'm having a heart attack, and I know that's no bueno. What do? Do you go to the emergency room and rack up the ER bill and risk having all those tests done to find nothing? Or do you not go to the ER and risk it really being a heart attack and wake up dead? I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Cardiovascular disease is the #1 killer in the United States. Heart attacks and strokes take many lives each year, and often people die of a heart attack or stroke when the day before they felt fine and there were no signs of the impending doom. So this is scary when someone does have chest pain, does have a potential warning sign, and then has that tension of, well, what is it? Should I go to the ER? Should I not? Do I want that bill or don't I? If you're torn, go to the ER, because you'd rather go to the ER and rack up a bill and be okay than not go to the ER in hopes of saving money and die. But today's video is to talk about the #1 cause of chest pain that's most commonly misconstrued as a heart attack, and that is costochondritis. Costochondritis is a fancy name for rib inflammation, or the inflammation of the cartilage between the ribs and the sternum, or where the ribs come around to insert or attach to the sternum. So inflammation in that cartilage, if you've ever had it, is very, very painful and is the most commonly mistaken pain for a heart attack because it happens right here in the chest. It's very sharp and painful, and it's often comes from a movement that you didn't realize you did. So what type of movement is that? Well, if you understand your ribs and how they attach to the sternum and to the spine, they're kind of like bucket handles, okay? So if this is one end, and then here's the front. So your ribs are like a bucket handle. When you breathe, they're doing this. Well, oftentimes you can create costochondritis by having a rib head pop out in the front or in the back. And the most common movement that will cause that is a bend, lift, and twist, okay? So if you're bending and lifting and then twisting back, it's easy to have a displacement of a rib head in the front or back, which causes big time spasm and big time inflammation. And if it's an anterior one, a lot of chest pain. And that can make you think you're having a heart attack and bad things are coming. So if you find yourself in that moment where you are at work or you're out on a fun day with friends and all of a sudden the chest pain comes out of nowhere, take a moment to assess, hey, did I just lift something heavy through a bend and twist mechanism? Or did I just have a massive sneeze and blow a rib out? If you can tie it to a mechanism like that, then you likely are having costochondritis or some sort of somatic or physical cause to the chest pain, versus if you can't tie it to a mechanism like that, you should probably go to an ER and get evaluated. Other things to think about is if you can touch it and it really, really hurts, that's more likely rib or somatic or physical, versus if the pain's there and you can't touch it or reproduce it, that may be more internal or organic and need to be evaluated quickly. So I hope this helps you both in two ways. One, to ease your mind and understand that what you're experiencing maybe isn't a heart attack, and also save you a big ER bill, but also help you differentiate between the two and know if you have that tension between should I go to the ER or not, that if you can't reproduce it and you can't tie it to one of these movements, you should definitely go to the ER. And if ever in doubt between the two, go to the ER, because you'd rather live and have to pay a bill than save the bill but lose your life.